But hey, I have a question for you. Do you eat food? I'm serious. If you eat food, you really need to watch this video, because there's this one thing that people are doing so poorly that it drives them into my clinic and they pay me a bunch of money to tell me that they're having these problems, that I just then say, hey, you need to go watch this video that I'm about to make, because I'm so sick and tired of people struggling with this issue, and I want to spread the word out to masses and masses of people and help them overcome this one condition that is greatly, greatly plaguing our world. And it's known as hypochlorhydria. And so if you eat food and you're struggling with things like gas, bloating, fatigue, especially after eating food, and maybe even joint pain, I'd strongly recommend you watch this, because hypochlorhydria is this condition that is greatly impacting a lot of people. And the cool thing is, it's so avoidable. You can greatly change this if you just start following these things I'm about to tell you in this video, so stay tuned. Okay, so my name is Dr. Austin Lake, and I help people all the time dealing with things like fibromyalgia, chronic pain, chronic fatigue, gut problems, psoriasis, all these conditions. But mostly what I get to help people with is becoming experts on their own health. And I'm so blown away by just how many people are dealing with these things that are having really simple root causes as to why they're happening to begin with. So what my goal is that with this video is I want to make sure that I can share with you the basics that really make a life-changing difference. And the cool thing is, you get to do them, and you get to start doing them now. And it doesn't require any fancy pills or medications or surgeries. And it just really gives you the power to become an expert on your own health. So let's get into exactly what I'm talking about and what I'm seeing that's causing a lot of people's problems and dysfunction with their health. Okay, so you're finally ready for the piece of information, the main content of this video? Okay, let's get into it. The problem I'm talking about is hypochlorhydria, and the thing that people do poorly is, ready? They drink too much water while they're consuming their food. And now this may sound like such a minor, minuscule detail, but I'm here to tell you that drinking too much water creates a big problem downstream, because what we always say in our practice is that you're not just what you eat, but you're actually what you digest, you eat, and what you absorb. And so if you're not absorbing your nutrients, or if you're not digesting your nutrients, you could eat really good quality food and be having major issues downstream that's actually being caused from poor, and this is the term that we like to use, but poor eating hygiene. And so eating hygiene is things like, what environment are you eating your food in? Are you rushed? Are you in a hurry? Are you in a stressful state? Are you driving? I really hope you're not driving. But if you're doing these things, you're setting yourself up for failure, because in your mind is thinking one of two things. Okay, either I'm in fight or flight, I'm like ready to survive, I'm ready to run away from this bear, or get in a fight, or I'm resting, I'm digesting, I'm in the parasympathetic nervous system state where I can consume food, I can do it easily, and it's not a big struggle for me. So just to keep it very simply, your brain is actually very, very simple in how this works. But if you're in a state of stress, your body's going to prioritize stressful mechanisms, where it's like, we got to move some blood around, we got to move some hormones around because we might be in a fight. We might have to increase this thing called fibrinogen just in case we start clotting, or we start bleeding. We need to clot really fast so we don't bleed out. Versus like, I'm trying to rest, I'm trying to digest, I'm trying to get good sleep, I'm trying to have good sex, I need to have good libido, I need to have good hormone production. All these are kind of functioning in two different worlds. And so if your body is not sure what you want, and you're eating in a state that's used to being in a fight or flight, your body's going to have a hard time secreting the basic enzymes that it needs to actually break down the food that's in your mouth and in your stomach and in your small intestine. So the best thing you can do is just to sit down, take a nice deep breath, really look at your food, smell it, enjoy it, and stop being in such a hurry. If you can start with that, that's such a critical factor. But the other factor is really, and again, listen to your mom and grandma when they tell you, chew your food. Most of us are not chewing our food, and this is leading to undigested food going down into our stomach that is now being, it's really big, it's bulky, it's hard to break down. It has to be in your stomach longer to actually break it down fast enough. And so this is leading to undigested food particles going down and throughout our stool. So chew your food. The third thing is, like I mentioned before, is to drink very little bit of water 20 minutes before and 20 minutes after you're consuming your food. And while you're eating your meal, make sure that you are only consuming enough water to help you swallow your food, just in case. If you want to, you can put a little bit of lemon in there, apple cider vinegar. This will help to increase the acidity, because if you remember back to your high school chemistry class, they talk about bases and acids all the time. And what we're really trying to do is make your stomach environment very acidic. And so it actually needs to be around like 1 to 1.5 as far as acidity level goes, which is very, very acidic. And so when we are drinking a bunch of water, we're actually diluting the stomach acid to where it's just not as effective as it could be. And so downstream, long term, we start to see these issues with like fatigue or bacterial overgrowth, where our bacteria is starting to be basically fed a buffet all day long on this undigested food. And it leads to more and more problems like SIBO, which is small intestinal bacterial overgrowth, or, the common term people use is IBS, which is irritable bowel syndrome, or IBD, which is irritable bowel disorder. And so, or disease, I can't remember, I have to look that up. But basically what this leads to is this whole host of these gut problems. And the primary one that we see is leaky gut or enhanced intestinal permeability. And that's a different video for a different day. And I've actually done some videos on that, so maybe I should just post those. But the point is that it leads to a whole lot of problems. And a lot of the root cause of autoimmune disorders or things like joint pain or fibromyalgia is really rooted in the gut. And so if you're doing something as simple as not chewing your food, drinking too much water, and eating in a rush state, you're greatly setting yourself up for failure when it comes to being a good digester and absorber of nutrients. So I hope this video is informative. I hope this makes a lot of sense, because it's really not that complicated. And this is why it just drives me nuts every time I have a client come in that they just say the same thing over and over again. So if this is you, I strongly recommend you start implementing some of these things and consider this, and talk to your doctor if you're on things like PPIs or Prilosec, because these drugs are actually designed to intentionally reduce your stomach acid. And these drugs were never intended for long-term use, but somehow along the way, people started having more and more acid reflux problems because of probably stress and eating in a hurry and all these kind of things. And so it's actually led to this, I think, a big problem where people are intentionally reducing their stomach acid, and instead of getting at the root cause as to why they're having things like acid reflux and GERD, basically, and that's really the biggest problem. So again, talk to your doctor about how you can gradually get off those PPIs, those drugs, or talk to somebody like myself, and we have plans and protocols on how to do that. But we want to make sure that we can actually do that safely and efficiently. But before you go that far, I would really just strongly encourage you to practice good eating hygiene, and you will see tremendous results if you do that. Have fun.